took my COVID-19 vaccine on the 23rd of March 2021. I was vaccinated at Nnamdi Azikiwe International Airport.
I got vaccinated with the COVID-19 vaccine on the 23rd of March 2021 at the House of the Association of General and Private Medical Practitioners of Nigeria here in Port Harcourt.
I've gotten my first jab of the COVID-19 vaccine on Tuesday, the 23rd day of March, at the Primary Healthcare Center, Kagoro, Kaduna South Local Government, Kaduna State.
So I had my vaccination on the 18th of March in the hospital on the island.
I vaccinated at East Ward 3, Modaike, Okechukwu.
Injection period was very short, just walking the document to take the vaccine, then sit down and wait for the card.
When we got there, we didn't waste a lot of time, although we got there ahead of the personnel that give the vaccine. So by the time they arrived, it was very fast.
Upon my arrival at the facility, I was quickly attended to within 10 to 15 minutes to the time I got the vaccine.
Every COVID-19 protocol was observed and they did not waste time. We were, called at our allotted time.
Like 15 minutes after I was vaccinated, I felt a bit woozy, like a slight level of dizziness. So after taking the vaccine, you are advised to sit down for like 30 minutes. I had pains like for 3 days, my arm where I was vaccinated. How I dealt with it, I would actually put something very cool like an ice pack on it for like 2 hours. So the pain wasn't so bad that I needed to be home or not be at work. I was working.
I didn't feel anything the whole day and the night, but the following morning I woke up with some generalized body pains and I felt sick. But that didn't prevent me from going on with my daily activities. I just took a couple of tablets of paracetamol and within a few hours I was myself. And besides, I was expecting the reaction because it's a normal reaction to being vaccinated.
There is no experience of any side effects, not a single headache or dizziness or fever.
I discovered that it's like I'm having malaria. They just tell us to take 2 paracetamol, and when I took the paracetamol, I'm okay.
Yes, I did develop side effects now. On the evening of the first day of my vaccination, I was feeling feverish. Next, it proceeded to me having body pain. I subsequently I lost my appetite. Also, I went to get analgesics. I was getting better. Then I think on the second, third day, I was still having pain on my left limb where I took the vaccine. Then there was a period, I think from the third day, I developed chest discomfort. Not as if it was that bad, but I could still do my day-to-day activity. After I took the vaccine, I ensured I was on analgesics, I was eating well, resting well, and all. And with time, I got better. I think my old symptoms lasted for about 5 days. But right now, as I'm making this video, and I feel very, very much good.
So I would advise people who haven't been vaccinated to get vaccinated. I know some people are scared of the side effects. They are mild, nothing that pain relief won't take care of. And if they are more than that, you should see a doctor, but it's not expected to be very bad.
I will advise them to go and take it because I feel better.
If you are yet to get your vaccine, I strongly encourage that you visit the nearest government-approved facility closest to you to get your vaccine.
Now, my advice to the entire public, I think you should take the vaccine. Now, these side effects are, there have been different reports. Some people did not have this kind of side effect like I did. Some people just had mild body pains and all that. So varying side effects. And these side effects are a spectrum that we actually expect with vaccines. so they are not abnormal in quote. And you should, I don't think because you're hearing people having side effect is enough reason for you to say you should not have the vaccine. So the vaccines are pretty much very safe and effective, and because I had those symptoms, it was just a pointer that my immune response was awakened. That's just what it means, which is the basis of vaccination, so that if in future I get infected by COVID-19 virus, I would not come down severely with infection.
Our advice the government wants to administer this vaccine efficiently and effectively. They need to deploy more people per unit.
I would advise the government on better public awareness, because I don't think there is proper awareness about the vaccine and its safety, because a lot of people are really scared about the vaccine. If there is proper awareness about the safety, it would increase the uptake of the vaccine. And the fact that it is free. Then another thing is proper channels of reporting of side effects. That would help with better research and studies on the vaccine.
Government should try to encourage people at the grassroots level, so they should be able to let them know the awareness.
This pandemic is an eye-opener to the Nigerian government. As such, more investment needs to be done in the area of health.